Hello everyone, this is Praveen. Welcome to KNO Academy. So in this session we are going to discuss some selected multiple choice question. So let's start this particular session. So the first question in this particular session is, a client with renal failure is prescribed a low potassium diet. Which food choice would be best for this client? So the question tells, so the patient is having renal failure. So the concept is here, the patient is having renal failure, one thing, and so they on low potassium diet. So which food choice would be the best for this client? So which food we can able to give for this particular patient which is having low potassium? So the most important thing is the low potassium. The food contain low potassium. So the first option A. Option A is 1 cup of beef broth. Option B is 1 baked potato with the skin. Option C is half cup of raisins. Option D is 1 cup rice. So here, so please do understand the question first. So here they mentioned renal failure where the kidney is not up to the the kidney is not having the capacity to excrete the nitrogenous waste. So one thing, so that's why with this particular background we need to take particular option in this. So the first option, the 1 cup of beef broth, which is a high it contains high amount of potassium, it's not an answer. And option B, 1 baked potato with skin, no, it is also not an answer. Then half cup of raisin, which is a it is a it contains maximum amount of potassium, so it is not an answer. Then 1 cup of rice. Comparative to the above three option, the fourth option is a right answer. So in this particular the question, the selected low potassium diet is 1 cup of rice. So we'll discuss some important points regarding this particular question. Yes. So first of all, what is renal failure? So the concept of renal failure quite very simple. So it is a decrease in the kidney function we can able to expect. Kidney function, the first thing, and there will be accumulation of nitrogenous waste. The second thing. So these two important points here in this kidney failure, and the foods that they have to avoid. The persons with renal failure or kidney failure, so they have to avoid certain food which is having the high amount of potassium, so increased amount of potassium. So the particular foods are maybe like we can able to expect. The first one is avocado, the thing. Then banana, that is also one of the thing we can able to expect. Then dates, which contains maximum amount of potassium. Then carrot, the selected fruits. Then the selected vegetables, which includes like carrot, we can able to expect. Then potato, then pumpkins, tomato and its juices, and the beef, and even the chocolate. So these are all the items which contains maximum amount of the potassium. So the patient who are suffering with renal failure or kidney failure, so for those we should avoid these particular the foods or these particular items. So this about the first important question. And the second important question is, an appropriate nursing intervention for the client with borderline personality disorder is. So here it's a question related to mental health nursing where a person is suffering with borderline personality disorder. So what may be the appropriate nursing intervention? So here, appropriate nursing intervention for this particular patient. So option A is observing the client for signs of depression or suicidal thinking. Option B is allowing the client to lead unit group sessions. Option C, restricting the client to the assigned unit of care throughout hospitalization. Option D is allowing the client to select a primary caregiver. So before move on to the topic, we have to understand the basics of borderline personality disorder, or we should understand the concept of personality disorder. personality disorder. Yes, so first we'll discuss regarding the some important points about personality disorders, then we can again we'll see this particular question so that we can able to understand the question and the topic at the same time. So this related to the personality disorder. So where so as per the DSM-4, this personality disorder as per the DSM-4, so the classification of personality disorders under three the cluster. So cluster A, cluster B and cluster C we can able to expect. So the first one, cluster A, where these particular persons are personality disorders individuals, they are having odd and eccentric behavior, like they are very hard, like they are like they are not at all like smooth behavior. We can able to expect odd behavior from these individuals. So the selected cluster A personalities disorders are, so the first important thing is paranoid personality disorder, and the second one is schizoid personality disorder, and the third one is schizotypal personality disorder. Schizotypal personality disorder. And the option B, sorry, not it's an option, it's a cluster B, is dramatic and emotional behavior. So in this particular, there are four important classifications, sub-classification we can able to expect. So the first one is antisocial personality disorder. Antisocial personality disorder. Then histrionic personality disorder. Histrionic personality disorder. Narcissistic personality disorders. The option D, sorry, not under the cluster B, it's not option B, under cluster B, the fourth one is borderline personality disorder. And when it comes to cluster C, the person, they are exhibiting anxious and they are very fearful. So this is the personality disorder. In this we can able to expect there are three important things. So one is avoidant personality disorder. Second one is dependent personality disorder. Dependent personality and disorder. So this is the classification as per the DSM-4 of personality disorder, cluster A, cluster B, cluster C. So there are 10 different personality disorders we can able to expect. So we'll discuss regarding the borderline. What is borderline personality disorder? Yes. So now some important one-liners regarding borderline personality disorder. So when we compare the gender, so the females, they are having more, the occurrence of borderline personality disorder is more in female compared to males, the first important thing. And the next important the one liners about the borderline personality disorder is, so they are instability in, so in which concept they are unstable. Instability means they are not stable, always they are changing. So the first thing is they are unstable in IPR, we can able to expect, that is interpersonal relationship, and instability in mood we can able to expect, that is maximum they may exhibit anger behavior. And the third one is the instability in behavior, that also we can able to expect. Then instability in self image, sometimes they are very positive, sometimes they are very negative. So these are the important things we can able to expect in case of borderline personality disorders. And also some other important points. So there is an recurrent behavior. So recurrent, they are having suicidal tendencies. So we can able to write it as suicidal behavior. They are exhibiting suicidal behavior. Then suicidal gestures and suicidal threats. So this person, they are having exhibiting all these things. And one more important MCQ related content here is the defense mechanism which used in a patient with borderline personality. So this is also one of the like frequently asked question we can able to expect, defense mechanism during borderline personality disorder. So what may be the defense mechanism here? The defense mechanism is splitting. So please do remember the defense mechanism which is used by the patients with borderline personality, which is splitting. Next important concept here is the one of the most important feature when it comes to borderline personality disorder is black or white or all or none phenomena. So black or white means, so all are good or all are bad, everyone is good. In sometimes they believe that everyone is good. In sometimes they may tell that everyone is bad. So this is also one of the important the criteria we can able to expect when it comes to borderline personality disorders. So with this particular the information, we can able to solve this particular MCQ. Now, an appropriate nursing intervention for the client with borderline personality disorder is, so already we know that she is having lot of suicidal behavior. One thing, the best answer in this particular thing is the option A. So we'll see discuss the three more option here why it is not a correct answer. So allowing the client to lead unit group session, yes, so it is highly impossible because already they are having the changes in the mood, behavior and IPR, so it is not possible, option B. And the option C, restricting the client's activity to the assigned unit care throughout hospitalization. Again, so there are a lot of the mood changes and behavioral changes we can able to expect in this, so it is not the right thing in this question. Then allowing the client to select primary caregiver, yes, so it is also not related to the question. So this is the concept regarding personality disorder. So next question. So the third question is, which of the following is an expected finding in the assessment of client with bulimia nervosa? So here, expected finding in patients with bulimia nervosa. Option A is extreme weight loss. Option A is extreme weight loss. Option B is presence of lanugo over body. Option C is erosion of tooth enamel. Option D is muscle wasting. So again, we'll discuss some important points and we will back into the question and we will discuss. So the important aspect regarding bulimia nervosa. Yes, it's one-liners. First of all, what is bulimia nervosa? So bulimia nervosa is an eating disorder. Everyone know bulimia nervosa. It's an eating disorder. Then, so when we compare the gender, so it is more common. It is more common among females. It is more common among females compared to males. Second important point. Then, what may be the features in this? So the features in this bulimia nervosa is binge eating. Binge eating episode means they will eat a lot of food in a small duration of time. Then, so to prevent weight gain, what they are going to do, so they will follow certain the purging behavior. So they are having the episodes of binge eating here, one thing, and the other thing is, so they are having certain purging behavior, so in order to control the weight gain. What may be the purging behavior here? So in order to prevent weight gain, they are having certain purging behavior. So it is more common among female, first point. Second point is they are having episodes of binge eating, means they are going to eat a lot of food items. So after that they feel bad about the binge eating. Then in order to prevent weight gain, they will exhibit certain the purging behavior or compensatory behavior, we can tell. So the compensatory behavior in this particular thing is the self-induced vomiting. The first aspect is self-induced vomiting. And they will use certain laxatives. They will use laxatives and they will use diuretics, and also they will use emetics. It's not anti-emetics, they will use emetics because they have to the vomit the whatever they hit. So emetics and excessive exercises. So these are all the purging behavior we can able to expect in case of bulimia nervosa. Important. This one also important. Next. So after secondary to purging behavior, what we can able to expect? So secondary to purging behavior, we can able to expect these things. There is an erosion of tooth enamel. So repeated vomiting that leads to erosion of tooth enamel. First thing. Then that leads to swollen parotid glands and salivary glands. From this we can able to expect like parotitis. parotitis also we can able to expect. Then one of the important thing, we in this particular the person with bulimia nervosa, we can able to expect there is an callus formation on knuckles. So the callus formation on knuckles we can call it as Russell sign. Important. So we can appreciate three important things here. There is an binge eating episode, there is an purging episode, and there is an like a secondary to purging. There are certain behaviors like tooth enamel, erosion of tooth enamel we can able to expect. Then parotitis we can able to expect, and also we can able to expect Russell sign, that is callus formation on the knuckles. So we'll see now. Yes. So now the question is, which of the following expected finding in the assessment of client with bulimia nervosa? So the first one, muscle wasting, will go with the basic. Muscle wasting, no, there is no muscle wasting here. There is no muscle wasting. There is an presence of lanugo over body, no. So the presence of lanugo over body, which is a classical symptom we can able to expect in case of anorexia nervosa. Next, extreme weight loss, no, it's not a, like maybe there is we can able to expect the weight loss, maybe or plus or minus, means maybe or may not be. So the right answer in this particular question number 3 is, that is erosion of tooth enamel. So due to the repeated purging behavior. So this is about the question number 3. Next, so the what may be the treatment when it comes to the bulimia nervosa? So here we can able to expect the CBT and also use of SSRI. CBT means cognitive behavior therapy. Cognitive behavior therapy. Then these SSRI, that is selective serotonin reuptake inhibitors. The specific drug here we are using is fluoxetine. We are using here fluoxetine. So these two things we can able to expect as a treatment when it comes to the patients with bulimia nervosa. The next question, the question number 4 is, assuming that all have achieved normal cognitive and emotional development, which of the following children is at greatest risk for accidental poisoning? So in this selected age group, which children, means which age group children is at the maximum accidental poisoning? That is the question. So the first, we'll see the option. Option A is 1 year old, option B is 4 year old, option C is 8 year old, option D is 12 year old. So what may be the answer? So can you guess in this particular question? So the first one is 1 year old, that is infant. No, obviously we can't able to expect accidental poisoning here, one thing. Then option C, 8 year old, obviously the cognitive behavior in this particular individuals is at the maximum, so it is developed, so we can't able to expect. And even in the 12-year age we can't able to expect the accidental poisoning. So the correct answer in this particular question is, that is 4 year old. So why it is for the 4 year old individual they are maximum risk at accidental poisoning? Because, so we'll discuss, because yes, so 4 year old they are having the increased mobility. The first one is there is an increased mobility, and there is a manual dexterity. So manual dexterity means there is an improvement in the fine motor in the hand. Manual dexterity we can able to expect. And the third important thing is curiosity. So due to the curiosity, there is a maximum the incidence of accidental poisoning we can able to expect in this. Then what may be the other accidental injuries at this age group? So the other accidental the injuries may be like struck in the car, so that also we can able to expect. Then falls also we can able to expect in these individuals. Then burns we can able to expect. Then drowning also we can able to expect in this particular age group at 4 years of old. So this about question number 4. Then question number 5. So question number 5, which term describe the play activity of preschool aged child? So preschool. So please do understand the question. It's a like most frequently asked question we can tell. So here they mention preschool age. So preschool age in a sense like 3 to 6 years of age. What may be the pattern of play? So whether it is a cooperative play, whether it is a associative play, whether it is a parallel play, whether it is a solitary play. So we'll discuss one by one. So the right answer in this particular thing, before we move on to the right answer, we'll discuss certain important points regarding the preschool age children. Yes, so sorry, already they mentioned. Yes, so the correct answer in this particular thing is associative play. Associative play. So then the some important things here. So the already I told the age, it is 3 to 6 years. Preschool means 3 to 6 years. So associative play means they are interested in playing with other children. They can mingle with other children and they are going to play. So these things we can able to expect. And the additional information is the cooperative play we can able to expect in case of the school children. Then parallel play we can able to expect in case of the toddlers, and the solitary play we can able to expect in case of infants, that is 0 to 1 year. Then toddler 1 to 3 year. Then school going child, that is then 6 to 12 years. So we can able to appreciate the important question in this particular slide. Next question number 6. The nurse is ready to begin an exam on a 9-month-old infant who is sitting quietly on mother's lap. Which should the nurse do first? So option A is check the Babinski reflex. Option B, listen to the heart and lung sound. Option C is palpate the abdomen. Option D is check tympanic membrane. So the question is very simple. So it's about the physical examination. It's going on. Physical examination is going on one thing. So from which thing we have to start early? So here check the Babinski reflex. So it is a invasive. Invasive in the sense it generates pain. Obviously it's not that much invasive, but it generates pain, the first thing. And the laser palpate the abdomen, obviously it generates pain. Option D, tympanic membrane. So again it's also generate pain. So listen to the heart and lung sound. Whether it's going to, it's just a auscultation. So initially we have to go with the auscultation. The right answer in this for this particular question is listen to the heart and lung sound. Option B is the right answer for this particular question. Next question number 7. In terms of cognitive development, a 3-year-old would be expected. So cognitive development, this question related to cognitive development. 3-year-old. So 3-year-old. Option A is think abstractly. Option B is use magical thinking. Option C is understand conservation of conversation. It's a conversation, it's not conservation, it's a conversation of matter. Option D is see things from the perspective of others. So 3-year-old child, what may be the cognitive development? So cognitive development in the sense like intelligence. So there is a theory which is from the Jean Piaget's. So there is a theory which is from the Jean Piaget's. So there are certain things we need to know about the Jean Piaget's. So before move on to the thing, so at the 3 years of age, so the child can't able to think abstractly. Option A is wrong. Option C, understand conversation of matter. No. Then option D, see things from others' perspectives. No, it is highly impossible. Then option B is the right answer. Yes. So here use of magical thinking is the right answer. So why it is right answer? Yes. Some important aspect here is the cognitive development. So the cognitive development here, which is by the gene Pidget's. Gene Pidget's. Again, it's also important one liner. Then so there are different stages. The first one is from birth to 2 years of age. So we can able to exhibit as sensory motor stage. Sensory motor stage. Option B is pre-operational stage. Pre-operational stage. Option C is concrete operation. Option D is formal operations. So in this particular 4 points we can able to expect any question. Like age also we can able to expect. Sensory motor from birth to 2 years of age, one thing. Pre-operational stage 2 to 6 years of age. Then concrete operation 6 to 12 years of age. Then formal operation 12 to 15 years of age and beyond. So this is about Jean Piaget's cognitive developmental theory. Next question. Next, question number 8. Which of the following describe the language development of 2-year-old? Language development. The question is about language development. Option A is does not understand yes and no. Option B is understand the meaning of all words. Option C can combine 3 or 4 words. Option D repeatedly asks why. So please do focus on the question. Here they mentioned the language development at the age of 2-year-old. When we expect the 2-year-old, the language, it would be whether the baby can able to understand the meaning of all words. No, it is highly impossible at this particular age group. Then whether they are asking repeatedly. No, it's not a thing here. Then whether they are going to understand yes or no. Yes, they can understand yes or no. So here in this option they mentioned does not. So it is not a correct answer. Then the correct answer in this particular thing is they can combine the 3 or 4 words. They can speak with 3 or 4 words maximum. So the next question. A client who has been receiving urokinase for deep vein thrombosis for DVT is noted to have dark brown urine in the urine collection bag. Which action should the nurse take immediately? So already the patient receiving urokinase injection, and so that particular urokinase injection is for deep vein thrombosis, and also there is an dark brown urine in the urine collection bag. So these are the 3 important the information which is given in this particular question. Then which action should the nurse take immediately? So please do focus on this term, immediately. So the option A, prepare an injection of vitamin K. Option B, irrigate the urinary catheter with 50 ml of normal saline. Option C, offer the client additional oral fluids. Option D, withhold the medication and notify the physician. So please do understand here. So this particular first thing is here there is an urokinase injection they use for deep vein thrombosis, and there is an dark brown urine. So which is the thing is there is an bleeding in the urinary tract. The first thing. Then so the option is prepare an injection of vitamin K. So in this particular scenario here we can't able to give the injection vitamin K, the first thing. Then irrigate the urinary catheter with 50 ml of normal saline. So here they asked immediately, so again it's not an the right option. Then offer the client additional oral fluids. Again, in this particular, immediately, it is not a right answer. So the correct answer in this particular situation is withhold the medication and notify the physician. Option D is the right answer, right option for the question number 4. Why it is a right answer? So let's discuss some important points regarding the urokinase. So first of all, urokinase, which is an thrombolytic agent. In which condition we can use this particular urokinase? So we can be able to use this under in DVT, that is deep vein thrombosis, then pulmonary embolus, then even we can able to use in MI, that is myocardial infarction. Then during this time, if there is the bleeding, then what we can able to administer? So we can able to expect maybe the physician will advise to use this Amicar injection. It's an injection. What may be the abbreviation or full name of this particular injection? So the full name of this particular injection is aminocaproic acid injection. So these are some important points regarding urokinase. Next question number 10. Which of the following can occur with the frequent use of calcium based antacids? So here they mentioned about calcium based antacids. What is the thing? So here the most important, the occurring things when we use maximum amount of calcium based antacids, that is whether option A, constipation, hyperperistalsis, then delayed gastric emptying and diarrhea. So here please do focus on the question. They mentioned calcium based antacid. So the most important thing in this particular question is the right option is constipation. So please do remember, it's not about hyperperistalsis, it's not about delayed gastric emptying, it's not about diarrhea. Yes, some information. So the calcium based antacids like calcium carbonate we can able to expect, one thing, and also calcium carbonate and magnesium hydroxide, that also we can able to expect. Then what may be the main function in this? So the main function of antacids, that is neutralizing stomach acid, then raising of pH, because from acidic to initially it is a acidic, so they are going to increase the pH of stomach acids or stomach secretion. That is the thing. Question number 11. Which statement made by the student nurse indicate the need for further teaching regarding the administration of heparin? Means which information? Here the student is lack, means she is not having the adequate information. So option A, I will administer the medication 1 to 2 inches away from the umbilicus. Option B, I will not massage the injection site after administering the heparin. I will check the PTT before administering the heparin. Then I will need gently aspirate when I give the heparin. So in this, please do understand here. So heparin, so they ask some information about heparin. I will administer the medication 1 to 2 inches away from the umbilicus. It is right. So one of the site for administration of subcutaneous injection is around the umbilicus. Is right. I will not massage the injection site. Yes, it's also right, because we are not going to massage when we given the heparin. So in that time we should not massage the area. That is also right. Then I will check the PT before administering the heparin. That is also right. Then the option for this question. So here it's not about the right. These are the right sentences, but in this the right answer is option D. Option D is the right option for this particular question. So here, so the student nurse not having that particular information. So here I will need to gently aspirate when I give the heparin. So no need to aspirate while giving the subcutaneous injection. So no need to the aspirate. That is the thing we can able to expect here. Next, So the important sites while giving the subcutaneous injections are upper arm, outer aspect we can able to expect, around the umbilicus that also we can able to expect, then even we can able to expect in the anterior thigh. In the anterior aspect of the thigh also we can give the subcutaneous injection, and upper outer quadrant of buttocks. Then they mentioned about PTT, that is partial thromboplastin time. Thromboplastin time. Next, question number 12. Question number 12 is, to correctly assess the oxygen saturation level of an adult client, the pulse oximeter should not be placed on the, where we should not place the pulse oximeter. Whether we are going to place the pulse oximeter in the finger, yes, the right thing. Then whether we are going to focus the place under earlobe, in some patients we are going to like place this earlobe in the earlobe, that is also the right thing. And the option C, extremity with non-invasive BP cuff, whether we are going to put the this one pulse oximeter, so no. Then nose, yes. So in this particular question, the right answer is obviously these things. Which one the right answer? Option number C. So please do focus on the question. Here they asked about should not. So here they mentioned should not placed. We should not place. So the option C is a right hand, extremity with non-invasive BP cuff. Next question. So question number 13. While caring for an elderly patient with hypertension, the nurse notes the following vital sign. So the vital signs may be the BPS of systolic is 140/40, pulse is there is 120, and the respiration is 36. The nurse initial action should be, what may be the initial action by the nurse? So the initial, whether report the findings to the physician, the first option. Second option is the whether recheck the vital signs in 1 hour. Option C is ask the patient if he is in the pain. Option D is compare the current vital signs with those on admission. So okay, we'll see one by one. We'll start with the option D, compare the current vital signs with those on admission. So no need to compare because already there is a BP of 140/90. So in this the question we can able to expect there is increased pulse pressure. So here we can able to expect there will be increase in the pulse pressure, raised pulse pressure we can able to expect. Then we can able to expect as tachycardia. Then tachypnea also we can able to expect. It's an emergency situation. So in that time no need to compare. It's not a wrong one. Then ask the patient if he is in the pain. So again it is not a up to the mark the option. Then option B, recheck the vital signs. Obviously we should recheck the vital signs in 1 hour, but it is not an initial action. So the initial action should be the option A, report the findings to the physician. So if we get the vital signs like this, immediately we have to inform the physician, consent physician. Then we can able to go for recheck the vital signs and all. But then we can able to compare those things we can able to do. Then question number 14. The nurse is preparing the client with an axillopopliteal bypass graft for discharge. The client should be taught to avoid. So what may be the thing we have to tell? We have to inform to the patient with the axillopopliteal bypass graft. First one, using a recliner to rest. Obviously we have to tell this one. They can use recliners. Then resting in supine position they can take. Then sitting in the straight chair. Whether we are going to tell whether they have to sit, no, they should not sit. Then option D is sleeping in right Sims position. So here when it comes to the avoid, so these three, option A, option B, option D is right when it comes to the information what we are giving. But here they mention what the client has to avoid. So in this regard, the best answer in this particular thing is the option number is C. So for the question number 14, so the option number C is the right thing. They should not sit on the straight chair. Next, question number 15. The doctor has added antithrombotic stockings to apply to the legs of a client with peripheral vascular disease. The nurse knows antithrombotic stockings should be applied. When they have to apply? So options: before the client arises in the morning, with the client in standing position, after the client has bathed and applied lotion to the legs. Option D, before the client retires in the evening. So for question number 15, so what may be the answer? So please do read the question again, and please focus on the alternatives or options in this particular thing. Here they mentioned the question as antithrombotic stockings when they have to apply. The first thing, before the client arises in the morning. Obviously the first thing, because in this particular thing there is decrease in the peripheral edema. Edema is less, means in the early morning. So the first option is right. Then with the client in standing position, obviously the standing position will leads to peripheral edema. So in standing position it's not a right thing. Then option number C, after the client has bathed, obviously it leads to standing position. So again it's not the right answer. When before the client retires in the evening, obviously it is not a right answer. So the right answer in the particular question is option number A. Next question. So the nurse has just received the change of shift report and is preparing to make rounds. Which client should the nurse assess first? Option A, client recovering from stroke with an oxygen saturation of 99%. Then a client 3 days post coronary artery bypass graft with an oral temperature of 102.2 degree Fahrenheit. A client admitted in 1 hour ago with rales and shortness of breath. A client being prepared for discharge following right colectomy. So what may be the priority here? So when it comes to the priority, so please do understand here the priority. We'll see from the down. A client being prepared for discharge following right colectomy. Already the patient is going to discharge. So here it's not a priority. The first thing, it's not a priority. Then a client admitted 1 hour ago with rales and shortness of breath. Yes, obviously it is one of the priority we can able to expect in this. We'll see some other option. A client 3 days post coronary artery bypass graft with an oral temperature of 100.2 degree Fahrenheit. Obviously it is also a priority thing. Option B is also priority, but it's not priority that much as option C. It is also priority, but it's not up to the mark as option C, the thing. Then a client recovering from stroke ICU with oxygen saturation of the 199%, means it's a normal. It's also normal. So in this particular thing, the most important priority which the nurse has to assess first is, that is option number C, because there is a problem with the respiration. So when it comes to like I want to add some important points here. When it comes to priority, please do remember follow these things. That is ABC technique. That is airway, breathing and circulation. There is the problem with the airway we can able to expect in this, or sorry, breathing. There is a problem with the breathing we can able to expect in this patient. So our priority should be in this. Then also we can able to expect Maslow's hierarchy of needs. Maslow's hierarchy of needs. That is also one theory we can able to use for the priority in order to focus on the priority. This is about the question number 16. The right answer is option number C. Next question. The next question is question number 17. A client with an femoral popliteal bypass graft is assigned to a semi-private room. The most suitable roommate for this client is client with. So semi-private room. Semi-private means there are 2 beds in the semi-private rooms. So there are 2 beds in the semi-private room we can able to expect in this. Okay. So who may be the like what the one more person we can able to in this particular room. So option A is hypothyroidism, diabetic ulcer, gastroenteritis and bacterial pneumonia. So here just focus bacterial pneumonia. Obviously it's a infectious condition. Then gastroenteritis, again it's not like. Then diabetes, ulcer, infectious. They can spread the infection, but the person with hypothyroidism, he can't able to spread the infection to the post-surgical patient. So the best roommate for this particular person is hypothyroidism, the person with hypothyroidism. Option A is the right answer in this particular question here. Yes, so the best person already I told, that is hypothyroidism. Next, so diabetic ulcer, gastroenteritis, bacterial pneumonia, so they are having the risk of infection to the post-surgical patient. So we can select the person with hypothyroidism as a roommate for the person. Next, question number 18. The nurse is teaching the client regarding the use of sodium warfarin. Which statement made by the client would require further teaching? Warfarin. The person is using the warfarin, sodium warfarin. Which statement made by the client would require further teaching? Means there is a deficiency of information in the patient. So these things we can able to expect in question. Then we'll see the option. Option A, I will have blood drawn every month. Option B, I will assess my skin for a rash. Option C, I take aspirin for headache. Option D, I will use an electrical razor to shave. First we'll see the right thing here. So if the person is taking the warfarin, what is warfarin? Warfarin is which is an anticoagulant. We can able to expect. First thing, if the person is using anticoagulant, there is a more increased chances of bleeding. So here I will use an electrical razor. Yes, they should use electrical razor. Then I will assess my skin for a rash. Yes, regularly they have to assess the skin. Is there any bleeding, rashes for that? Then I will have blood drawn every month for blood investigation, regular blood investigation. That is also right thing. Then which sentence? So please do remember, if the person is on the warfarin, so the person should not take the aspirin. Here the option C is the right when it comes to the question. Means there is some deficiency of information in this particular patient. So when it comes to the question point of view, the right thing is, the right option is option number C. Option number C is the right. Yes, some information regarding the warfarin, which is the first important thing is it's an anticoagulant. Then aspirin, what is aspirin? Obviously, so it's an antiplatelet aggregator, so maybe there is some bleeding tendency is more. So bleeding tendency, increased bleeding tendency, so we should not advise the patient to take aspirin or any NSAIDs. Next, question number 19. A client returns to the recovery room following repair of an abdominal aneurysm. Which finding would require further investigation? So the question number 19, already the person repair of an abdominal aneurysm. So first information, what is aneurysm? Aneurysm, which is there is a localized the dilatation of artery, we can able to expect. Localized dilation of an artery. So where? Here, abdominal. Which finding would require further investigation? So first aspect is pedal pulse are regular. Yes, regular. Okay, what's the problem? No problem at all. Then option B, urinary output 20 ml in the past 1 hour. Maybe there is a problem. Option number B. Option C, blood pressure is 108/50. Yes, it's okay. It is okay only. We can able to expect. Then oxygen saturation is 97%. So please do compare the option. So option A is okay. Option C is also okay. Option D is also okay. But when it comes to option C is also okay, option D is also okay. When it comes to the option B, urinary output 20 ml in the past 1 hour, so obviously it is not a okay condition. In this particular thing, the investigation, so because maybe there is a kidney injury we can able to expect, because there is an during the this one ligation or this procedure, so they may block the artery, which the blood may inadequate blood supply to the kidney we can able to expect. So that's why in this the right option here is option number B. So they have to investigate. Yes. Next. Yes. Next is question number 20 and the last question of this session. The nurse is doing bowel and bladder retraining for the client with paraplegia. Which of the following is not a factor for the nurse to consider? Here, which is not a factor? So first aspect is diet pattern. Yes, obviously it's a most important thing, because the person is having paraplegia. Then mobility, it's also important thing. So, and also you need to understand the question here, bowel and bladder retraining, fluid intake. Yes, that's also important, the concept. But say when it comes to sexual function, it is not a concept, it's not an important concept here for bladder and bowel retraining. So here the right answer is sexual function. When it comes to the information, it is a right information. Diet pattern is the right, mobility is right, fluid intake is right, and the right answer here in this particular question, when it comes to the question concern, the right answer is sexual function. So it's not a factor to consider. Idu factor, it's not a factor. Yes. So bowel and bladder retraining, the important factors are the dietary pattern, mobility and fluid intake. So if these particular things is completed, means maybe so there will be decrease in the episodes of constipation, increased in the urinary output, and they can use the bedpan and all. So this is the concept of bowel and bladder retraining. So yes, this about the today's session. So thank you for your time. So wishing you all the very best for your preparation.